place to find out everything you've ever wanted to know about pain. My name's Joe Parsons and I'm joined by the wonderful Dr. Joshua Craw and Don Wijasoria. Today we're going to be talking about clinicians and their pain education. Welcome in.
Hello and welcome to Pain in the Podcast. We're going to kick off today's episode, as we kick off every episode, by getting to know ourselves a little bit better and by giving something that we've learnt about ourselves this week. So, my fact this week is that I'm incredibly hypermobile. So, although I don't have like a formal diagnosis of hypermobility, I score highly on what they call the Brighton scoring system, which is basically how much your joints bend and how flexible you are. I score a 10 out of 10. Well, a 9 out of 10 because I did my knee in and it's got reduced flexibility in that now. But, I think I'll give myself that one since,
No, that's...
For getting such a high score, Josh, would you like to give yourself a round of applause? But with your elbows going forwards.
Oh, do you know what? I need to... well, the thing I've learnt about myself this week, so I can't do that this week, but I will do it another week
Okay.
for our Patreon subs.
Excellent. My fact about myself this week is that I can make a 3-leaf clover shape with my tongue.
Ooh.
Demonstrate.
Damn.
That is impressive.
I'm going to go right up. We're sat on the sofa recording this, so I'm going to go right up to the camera for the Patreon subs and just show them my tongue. And then,
Get a bit of ASMR in there.
Yeah. I don't know how was I going to see it on camera? There we go. Cool.
Sound like that turtle having sex.
Right, have you got your fact yet, Don?
Let's go with the fact. So my fact is quite boring actually, but it is that I really like photography and I just like taking pictures of random things. I'm sometimes that person at the party with just a camera taking very...
No clothes, just the camera.
Yes, you'll spot me easily.
Are we going to put up your favourite photo you've ever taken on our socials?
Ooh.
Yes.
Ooh, what's that?
I don't know what it is.
I don't know
I was
either.
just fishing.
Oh, right, okay, yeah, I thought this was...
No.
I think I have a few. Yeah, we can choose one of them.
Cool.
Okay,
What have we learned about ourselves this week?
yeah, so what I've learned about myself this week, which is why I'm not doing the fantastic elbow clapping, which I'm renowned for, is that you can hurt yourself in many ways for a great deal of time from the most innocuous things. So 3 weeks ago, I was carrying a heavy bag of shopping, and since then, my left elbow's been in pain.
And that makes a lot of sense as to why you're not doing the clapping.
So Thursday night, I was doing like a cupboard shop, so like getting all the essentials in.
Tins
Wait,
and-
do you shop by category?
You don't shop by category?
Well,
Yes,
do
Josh is like, yes, it is my monthly fridge shop.
like, oh, Monday's your fridge day, Friday's your freezer day, and then
Yeah, it's
Tuesday's
like
your
instead of going
cupboard
to the
day.
gym, like if you want to work different like muscle groups, he's like, okay, we're going for more reps, so I'm going to go further away and I'm going to pick up my dry
Incredibly
goods.
efficient.
No,
Well
it
done.
was payday, so I thought, let's fill up my cupboards a bit more.
Yeah.
Go mad with the cupboards.
So yeah, I've got a bit of tendon injury on that left elbow, so still not 100%.
So stay tuned for next week's episode where he does clap with his elbows.
Well, I don't think I will be.
Okay.
Considering we
you
have already filmed
recorded it.
next week's episode.
But we'll find a way.
Maybe
to put it in
episode
there.
6. That
Maybe
seems like
episode
it could
6.
be,
We can do episode 6.
Episode 6.
So this week I learned about myself that when I'm hungover, I kind of like to punish myself by wearing my retainer. So I never wear my retainer, and my teeth have definitely moved a little bit, and so it's really quite painful to put my retainer on. And when I'm hungover and have dry mouth, I'm just like, well, you may as well just embrace how horrible it feels and just ram the retainer in and make myself feel horrible.
Yeah.
So I only learned that about myself this morning.
Damn, yeah.
But I've realised doing it this morning that I do this every time I'm hungover, which is I don't drink much, so maybe every 6 months I'll wear my retainer for one day and just punish myself.
So I made the mistake about 2 years ago. When I was in secondary school, I played rugby and I had like a proper gum shield.
God, yeah.
And I was like, do you know what? My teeth haven't changed that much in like 14 years. And I put it in and my God, it was the most uncomfortable thing I've ever had.
Yeah. Did you have braces?
No.
I was going to say, I thought
my teeth can't change that much.
How have they changed? Do they just like shift?
they're just bigger.
They're just bigger.
Every year.
They just keep growing.
Surely they decay slightly, no?
Yeah, but I
But-
mean, if you have any dentistry work as well, so like, it's just like
Crowns,
your teeth ship
fillings.
as well. So like, you get your wisdom teeth in. So that's a big thing that really
Yeah.
shifts your
Yeah.
teeth. And that's how we're going to go on with this podcast. We're just going to talk about dentistry.
Yeah. And last but not least,
What have I learned? So I've learned that I have not given up on learning how to whistle. Because I thought it was just impossible for me to whistle all this time. But I've been trying it when I'm alone in my car. And it's not been going great. And it takes a lot of memorization of exactly where to have your lips.
Memorization.
Like, just I don't know. I don't think people who can whistle are actually that aware of what their lips are doing. Whereas for me, it takes a lot of concentration.
but you can do it now.
No.
Well, you tried whistling last night
Let
and
me
you
try.
couldn't.
Yeah, it's
Have
still
you
a
seen
no.
Peppa Pig? When it's like Peppa Pig rings up Susie Sheep and she's like, Susie, can you whistle? Peppa, what's whistling? You put your lips together and blow. And she's like, what? Like this? And then Peppa Pig just slams the phone down. Oh, sorry. Yeah,
Well,
very, very tangential.
That sheep can whistle better than I can.
Right, should we get on?
Let's go.
Let's. So, as a clinician in the room, I want to start this episode by telling you a little about the education that I got on chronic pain. People who suffer with chronic pain, I imagine that they assume the doctors have a great deal of expertise, they've had a lot of training on how to manage chronic pain. For me, in terms of actual formal education, so sitting down, doing lectures, learning about pain and chronic pain, I think it's probably somewhere between 10 and 15 hours,
Yeah.
which
Doesn't sound like a lot.
that's not a lot. You can knock that out in an afternoon.
Yeah.
Well, 2 afternoons.
I imagine that's quite a big problem when it comes to addressing chronic pain in patients.
Well, yeah, I think you're right there, Don. I mean, up to 1/3 of GP appointments are for MSK problems. 22% of appointments for back pain alone. So, when every 2 out of 9 of your patients are coming in with back pain, knowing how to manage it, I think that's quite essential.
Yeah.
I mean, there are 23 million people living with chronic pain in the UK right now. That's 23 million.
Yeah.
That's what, 1/3 of people?
It's 43% of adults.
43% of adults.
Wow.
Jeez. Yeah, I mean, well, 100% of people on this sofa have chronic pain, so I suppose it's slightly less than 100%.
So if you take us as a representative sample of everyone, everyone has chronic pain.
Yeah, I mean, and that includes high impact pain, doesn't it? So
Yeah.
that type of pain that really impacts your day-to-day living and how you can function as a person, how you can work, clean, cook, and look after yourself, really.
Yeah. And there's 5.5 million people with that high impact pain in the UK. So
5.5 million?
5.5 million.
I genuinely wouldn't have thought it was that high. 5.5 million, that's what, it's about 8%-ish?
Yeah, something like that.
Wow.
It's a big old number. So in essence, there's just a lot of people with chronic pain who are looking for medical support, and the people that they're going to just basically don't get the training. There's this. There's a really good podcast called Airing Pain. If you really want to get into like the nitty gritty information about chronic pain, there's made by Pain Concern, a charity up in Scotland, really great. And they do episodes about different things, and they were talking a little bit about pain training. And there's a pain consultant down in Gloucestershire called Helen Makins, and she says that when she moved into the pain field, she was like, I had zero concept of self-management. I had no idea about proper management for chronic pain. Like, I thought pain seemed cool, and I thought it would be easy. I thought it'd be like, okay, let's just give some medications, whatever. But even someone going into the pain field at that point who'd made that conscious decision still admitted that they just knew nothing about pain.
Wow. I think that really drives the point home. I've done a little bit of looking into different countries and different medical sort of models. And when we look at mandatory chronic pain education, New Zealand, Australia, Canada, they have about 20 hours. UK, about 13 hours across 6 years of education. So that's like watching one movie every year of medical school.
Yeah.
That is shocking.
Yeah. It's not even Lord of the Rings. It's not even a good movie.
Now,
It's a straight to DVD.
Oh, it's one of those Disney sort of like Jafar's Revenge
Yeah,
sort of things.
I like that.
now, 13 hours is obviously not a lot, but some of you might be thinking, well, doctors are fairly intelligent people, and
Not Josh, though.
No, definitely not me.
not this one, sorry. And you'd imagine doctors to get the most out of 20 hours, and they'd be fairly qualified at that point. But just for some context, in Canada, vets get 87 hours of pain management training in their degrees. 87 compared to 16 for doctors. So either they're suggesting that vets learn 5 times slower than doctors, or the doctors just aren't getting enough pain education.
Wow.
Yeah, if we've got any vets listening, please write in, tell us, like, if you are just incredibly dense.
And we're talking about veterinary doctors, not like combat veterans.
Yeah.
Oh, yeah. That
They
yeah,
get
for
way
the
more
American
training.
listeners.
Yeah, to be fair, I imagine the army gets a
Yeah.
lot more
Pain training,
pain
probably.
training, yeah.
Yeah.
Particularly
But-
acutely.
Yeah, so maybe doctors are just amazing at picking up information, but we wanted to test the theory. So we wanted to search up what can you learn in 20 hours. So we're taking our resident doctor, Josh, our PhD doctor, me, and our psychologist in training, Don. So all kind of in that medical field, all in that pain sphere. And we're going to challenge each other to learn a brand new skill in just 20 hours. So originally we looked for some suggestions of skills that we could learn on Google. And there were a few, which, I mean, we did consider challenging each other.
So Quora, according to Quora, you can learn to take off and land a plane within 20 hours.
What?
Yeah.
With an instructor by your side.
But we couldn't afford to pay for your lessons, Josh. That was the problem.
Do you know what? I'd really love to learn how to fly a plane.
Yeah. Well, if you Patreon subs,
Can we get Josh learning how to fly a plane?
yeah, that's when we'll know we've made it. When there's a picture of Josh on the Instagram flying a plane,
Yeah.
that's when you'll know.
But with absolutely no passengers.
Maybe one of those planes, you know, in supermarket car parks, like the little ones the kids go in, and it's like.
Yeah, definitely wouldn't fit on that. For those who are on Patreon, you can see I'm a hefty man.
Yeah. What else did Quora say you could do in 20 hours? Intermediate level Excel.
Excel.
Excel, as in like Microsoft Excel. You can get to an intermediate level in 20 hours.
You can't excel at Excel, but you can, you can definitely be intermediate.
What else did it say you can do? What did it say, Josh?
Well, Don, why don't you...
So apparently if you're a smoker, you can create vape rings. Learn to
Nice.
create vape rings.
Vape rings? Ooh,
Yeah,
that's
it's a
nice.
really cool thing to do.
Yeah, Business Insider says that you can learn to either tell a great story or break an apple apart with your bare hands.
I'm sure it doesn't take 20 hours to do that.
No, but if it's the same apple, maybe it's just wearing down the strength of the apple over 20
Very,
hours.
very slowly.
Yeah.
Like gumming it to death. So I think Iris reading say that you can learn how to read people's emotions in 20 hours.
Okay.
Okay.
I mean, if somebody's coming at me and look angry, I don't need 20 hours of learning to figure out I'm going to get punched.
The 20-year-old baby, 20-year-old babies, the 20-hour-old babies now perfectly understand emotions then, according to irisreading.com.
Well, if they put the effort in, maybe.
Maybe. That article also said that you could learn how to breathe.
In
which
20 hours, yeah.
I'd be really concerned if
Learning
the
to
people
breathe. Oh, thank God.
Oh, right, yeah, so either way, these skills, other than the playing one, we thought were a little bit naff, and they don't really transmit very well as a podcast medium. So Josh is just grunting for 20 hours trying to break an apple apart. No, so we decided to be a little bit more original, so we got together in each of the pairs, and we thought of a skill for the third person in the group. And so throughout this episode and the next few episodes to come, you're going to see the progress of just how well we did, and you can judge whether you think that 20 hours is enough to learn a new skill. So keep listening to find out.
So, to start off today, let's talk about what we mean by pain education and talk about what clinicians do actually learn at university. Let's just start off with the fact that only 9 UK medical schools out of the 46 have compulsory education on pain, according to the publicly available syllabi. I mean, we can't, like, I went to St George's, for example, so I can only really say from St George's.
Yeah.
If you're a doctor listening as well and you've been to another medical school, we'd love to hear what your actual learning on chronic pain was. I think that'd be very interesting and quite helpful for people, really.
Yeah, especially if the syllabus is on, because some of them are great, some of them are super in-depth, some of them aren't very clear. So if you can clean this fact up, if you can tell us that actually your uni was great, then please do let us know.
Yeah, we'd like to know which universities are really doing well. Maybe we could do something about that.
How many apples did it take for you to learn about chronic pain?
How many apples? Half an apple, maybe. Well, looking at some of the universities, as I said, if these are your alma mater, please let me know if this is accurate. The University of Buckingham teaches students how to recognise pain and what to prescribe in response, not paying any heed to any of the other management strategies for pain. So it's a case of, okay, here's some paracetamol. Yeah. Should I use ice, doctor? Paracetamol.
Is the ice buried? Is the paracetamol buried within the ice? If so, then possibly
it might work slightly better.
Yeah.
The University of Manchester students have a one-off session about recognising and managing pain.
Sorry, just speaking of the University of Manchester doing this, I definitely did my PhD somewhere, and it may or may not be relevant to the university that you just mentioned, but I actually wrote to their head of syllabus for medicine because I had friends who were like, I was like, how much do they teach you about pain? And they were like, oh yeah, nothing. So I was like, cool, that sounds dangerous. So let's write an email offering to come in and do a lecture, like from a lived experience point of view. Like I've got a lot of experience working with people with chronic pain, huge amounts of interview experience. I'm retraining as a physio right now. So like I've got all of these skills that I'm putting together where I think I could do a decent job of giving people this foundation. And they were like, oh no thanks, but we've actually got really quite an extensive pain module. So I was like, okay, can you tell me anything about it? And I never got a reply.
You never got the reply.
Oh. Yeah. So there you go. That
maybe your friends just missed that lecture and it was just one lecture.
Maybe. Well, to be fair, they did say on their syllabus they only mentioned one-off session. Like
there
Josh
you go.
says.
Then,
so there you go. Either way, sorry. Back to it, Josh.
The University College of London, so a London university, you'd expect maybe they're somewhat better at teaching. Not necessarily. I went to a London university. So UCL do a module just about surgical pain, which has no mention of chronic pain whatsoever. So if you're going under the knife, fantastic. You're not going to feel a thing. But if you've got any pain afterwards, maybe you've got a bit of a problem. Staying down south, the University of Southampton, they do case studies of low back pain, but don't appear to address any other conditions. But I think that's somewhat better, you know. We've already established that 22% of people in the UK of GP appointments are for back pain. So actually, I suppose that's better than no chronic pain.
Yeah, if you're going to tackle one condition, I guess it's the one that makes sense.
Wow, the bar is very low.
Yeah.
The bar's low, which is ironic, because if you've got back pain, you're not going to get under that bar. Queen's University of Belfast have lectures on psychological underpinnings of pain, but nothing about psychological or social elements. So, yeah, if you've got pain, maybe it's depression.
Yeah.
That's it. Nothing else. Moving across the border, St Andrews have lectures about pain as a behavioural science. That's alongside lectures about stress. Yet again, coming from a very psychosocial point of view as opposed to a physiological point of view for chronic pain, which I think we've got future episodes planned regarding sort of psychological elements of pain.
About that whole biopsychosocial model.
Yeah, exactly. Yeah. Oxford University do lectures on sensory nerve fibres and the nervous system and referred pain. So, Oxford University, I mean, it's one of the most respected universities in the world. You'd expect them to be absolutely on it when it comes to education. Yeah. Seems like they're good with the science, but maybe not necessarily with the actual practicalities of treating.
Which is odd as well, because very, very famous pain researcher Irene Tracy actually lectures there.
Ooh, okay.
But by the looks of it, the med students barely get to meet any of her or her
Someone's
team.
holding her back.
Yeah,
it's a bit of a shame, really.
So go on, Irene. Go get them.
Yes.
Come on, Irene. Oh, teach them about pain. And Newcastle University, which is where Joe and I went to for our undergrads, they have a module on pharmacological, psychological, and physiological managements of pain. So actually, in a full module, which sounds like it encompasses quite a lot of chronic pain. I think it's probably about the best.
It's pretty good. We're getting better slowly.
Yep, but topping the charts with the most comprehensive syllabi in terms of chronic pain. As I said, this is just from publicly available records, so we can't make any comments on other universities. But Exeter University have a module called Pain, the Brain, and Anaesthesia. This addresses the anatomy of pain with nociceptors and spinal cord and ascending and descending control. That's basically how your brain controls all the nerves in your body. It details the mechanisms underlying different chronic pain conditions. It looks at a role of cognitive and affective influences on pain experiences. It talks about assessment of pain and management methods. So I think the other universities, you need to take a leaf out of Exeter's book there, because that seems pretty comprehensive for me.
Yeah. So if you're a medic or if you're wanting to be a medical student and you're like, I really want to go somewhere that's got the absolute pinnacle of pain education, then you better head down to the south west.
Oh dear.
East.
Yeah.
South. Where's Exeter? Right, I'm
East,
gonna go.
yeah.
We are scientists, we're not geographers.
Right, where's it? Cornwall.
Oh, yeah.
Cornwall southwest, right?
Nice,
that is
yeah.
west.
Isn't too bad.
Why was I thinking of Essex?
Pew pew pew.
Wow.
Sorry.
Okay, yeah.
Yeah, southwest. Get yourself down to the southwest.
It's lovely there. So that's 2 universities in the country, Newcastle and Exeter, that provide anything close to a comprehensive pain education for their students. Now, some degrees like nursing, physiotherapy, and occupational therapy may put more of an emphasis on pain, but that isn't to say that they do particularly well either.
Yeah, there's a study of final year physiotherapy students in the UK, like across multiple universities, and there was an 8-question pain test that was deemed to be essential clinical knowledge. That was what was quoted in the studies. They said that these were essential questions. What percentage do you reckon got them all right?
These are final year students.
These are final year students.
So
8 questions, only 8 questions, and they're all deemed essential.
It can't be that hard, right, with 8 questions? I'd say about 20%.
Okay, that's a low ball, but cool.
I'd probably say something like 2/3. Like in your final year, I'd expect you to be able to get your answers right for essential questions.
Yeah, it was 4%.
Ooh, whoa. Okay, 1 in 25. That's
1 in 25 got all the questions right. So these people are professionals who are expected to work on a daily basis with people experiencing chronic pain, but they're basically just getting no preparation to do so. So it's, yeah.
So coming up very shortly, we're going to talk about what the effects of this lack of education are for the patients. But in the meantime, let's dive into the first part of our 20-hour challenge. Just a reminder, medical students across the world receive no more than 20 hours of compulsory training on chronic pain during their degree. So we wanted to test just how good you can actually be at a brand new skill with just 20 hours of training. And it seems like I'm the first to get my challenge, so let's see what these 2 idiots have in store for me.
Well, Joe and I debated a lot of different ideas here for this.
We did.
And I think we've come up with something that is spectacular. Joe, would you like to?
Yeah, so Don, you are going to be spending 20 hours...
Wait, before we even hear this, I just have one condition.
Right.
No birds.
No birds, there's no birds.
Sweet.
Yeah,
I knew that was a condition.
For those listening and watching on Patreon,
You get another fact from me.
you get another fact.
Yeah.
This is a bonus fact.
It is a
What
bonus
is that bonus fact?
Bonus fact is I am shit scared of birds.
What birds in particular?
Don't say it, people are going to send pictures in.
That's happened in the past. Yes.
Oh yeah. Sorry, nobody send any pictures of any specific flying rats to Don. I mean, birds.
You know what?
Either
If
way.
this turns out to cure my fear of birds, I'll be happy.
This is version
Joke's
therapy.
on you.
Yeah, true.
Yeah,
It's
and
immersive in
Just
pictures.
exposure therapy.
For a little bit of extra for those people watching on Patreon as well. Joe decided to wear socks with pigeons on yesterday.
It wasn't a conscious decision.
You knew I was arriving that night.
Yeah, but I didn't think... I wasn't just like, I'm going to put on
in
some
the
socks
morning, I'm
that
going
will
to wreak
distress
havoc
Don.
on Don's fear. Just wear pigeon socks.
Right. It had one small pigeon, and it was not... either way.
It was
Right,
incredibly
Don,
detailed.
Your 20-hour challenge that we have come up with is we are asking you in 20 hours to become an expert at slam poetry.
Oh no!
Yes.
At the end of those 20 hours, Don, you're going to be performing at a spoken word open mic night with one of your own poems.
You're joking.
No.
Wait, where is this open mic night?
We're going to go to one in Manchester. There is a spoken
Oh,
word open
gosh.
mic night. So we are going to give you 20 hours.
Oh, I hate you two.
I can't remember whose specific idea it was. I think we both came up
I
with
think
it.
we did.
I
both
kind of
do
want
it.
to I want to change our idea for Joe now.
Well,
Well,
you can make it.
Oh,
as-
we could change it. But
Either way.
I feel like mine's not cruel enough. I mean, ours isn't cruel enough for Joe.
well, we'll see.
Alright, so it's the 20-hour challenge, and I have been tasked with learning slam poetry and supposedly becoming an expert. But what the fuck is slam poetry? I bet they don't even know what it is. I don't know. I'm so out of my depth with all of this. I'm really annoyed at the other two hosts. I feel like I helped choose fairly fun and realistic challenges for Josh and Joe, and they've absolutely screwed me with this. I'm not a very poetic person. In fact, English literature was probably one of my least favourite subjects at school. And looking back, I don't think I've even looked at a single piece of poetry since, apart from like the odd cheesy Instagram reel promoting self-acceptance and whatnot. But yeah, I've no idea what slam poetry even is. I know what poetry is, but why is it being slammed? I don't understand. Does that mean that it's just like really, really loud poetry? Alright, let's look it up. So apparently it is a competitive form of poetry. What the heck does that even mean? Are you competitive? Are you kind of debating a topic in poetry? Or is it just a weird way of describing a poetry competition? I don't know. But this is going to be quite a challenge. And if a medical student can supposedly become an expert in pain under 20 hours, I'm sure I can become an expert in poetry in under 20 hours. Let's do it.
I know for one that I am very excited to see how Don gets on. If you want to see more of the 20-hour challenge with Don's slam poetry or Josh's and I's challenges, then you can go and see them on our Patreon, and we will release little snippets as we go along on our social media, so keep your eyes peeled for that.
So we've spoken up to now about clinicians' lack of pain education, but what are the effects of this?
Well, the first thing I think has got to be clinicians lacking belief in what patients say. So if they don't understand the difference between chronic and acute pain, they struggle to understand why people aren't getting better. And so rather than trying to continue helping the patient, it's easier to just accuse them of making it up, to just say, well, I gave you these pills, you should be feeling better, and you're not feeling better, so it's all in your head. And if you don't believe me, look at the references in our show notes, and you can see academic papers where clinicians estimate that 30 to 40% of the people they see who say they have chronic pain are malingerers, so making it up for attention, effectively. So, yeah, that's a big old percentage that they're estimating are making it up.
Yeah, that's very cynical.
Yeah.
So for those of our listeners who might not know the difference between chronic and acute pain, can you just describe that?
Yeah, so chronic pain is a little bit of a wishy-washy definition, but it's pain that persists consistently for more than 3 months. The definition is a bit wishy-washy. It could be 1 month, 3 months, 6 months. Like it doesn't really matter what the time frame is. But the key thing is that acute pain is pain that's expected to get better within 8 to 12 weeks, whereas chronic pain involves changes in the brain called sensitization, and it's where your nerves basically get riled up, and so they get more easily activated. You're in pain more often. You might have something called allodynia, so where you're sensitive to things like touch, so you might get pain from things that other people would consider normal. So like a handshake might be agony for you. That's not everyone with chronic pain, but it's these ideas of like the nervous system is getting wound up. So that's kind of the key difference between
Changing with time.
Exactly.
Yeah, and just to defend my fellow clinicians, I feel like I need to. We've mentioned about this figure of 34, thinking 30 to 40% of people malingerers or what have you. I don't really like that term, but it's in the literature that we've looked at.
Yeah.
I think this is very much going out of vogue at the minute. You see, particularly with the younger doctors coming in like myself, we're a lot more open-minded. We know that, you can't cure everything.
Yeah.
Like, I'd like to think in my own practice, I'm thinking more about instrumenting sort of segmental changes, so like small increments over time to try and help chronic pain, as opposed to here's a wonder pill that's going to solve all your problems.
Yeah.
I think that's one of the things clinicians don't do very well, which is managing expectations.
Yeah.
So I've seen it myself, particularly as a medical student, clinicians saying, here's a medication, it's going to do X, Y, Z, it's going to be great. they're not saying that actually, here's medication, it's going to take a couple of weeks to actually kick in. The effects are slightly better than a placebo.
Yeah.
And there's some negative effects as well.
Yeah. I mean, it's interesting that you say, though, like, about clinicians of your new generation of doctors being more open-minded, more accepting of things being, like, possibly incurable. Because I'm really lucky. I get to do some work with Dr. Deepak Ravindran, or he might now be professor, actually, because of his position at Teesside. So very exciting. Congratulations, Deepak, if you're listening. He wrote an amazing book called The Pain-Free Mindset. He's kind of a leader in the field of pain management here in the UK. And he says that a lot of the clinicians that he's met, like recently, who are kind of the younger generation, don't understand these kind of like more holistic approaches to pain management. They're still in the old school, like just the ones he's met, but they're still very much the old school of like, well, we're going to give them spinal injections, we're going to give them local anaesthetic injections, and they don't really recognise the value of any of the wider aspects of treating a patient's life. So like looking at how their social life is, looking at their family, looking at their work situation, the stress that they're under, looking at their finances, like all these things which can wind up your body. Like he actually said that he'd had the opposite. So I hope you're the majority, like the people like you who are really engaging.
I mean, I went to St George's, and that really St George's really does sort of highlight communication skills and those softer elements of being a doctor.
Which can be quite demanding on clinicians.
Oh,
Not everyone.
It can be quite emotionally demanding, yeah. Like, as I said, like, we've looked at some very good universities there that have some great teaching on, like, the actual science behind pain, but in terms of actually managing it, almost non-existent.
Not great. Also, as well, like, just thinking about the other effects of the lack of education, there's one that's really prevalent, and that's the clinicians sending people for scans when they don't need them.
Yeah.
And now, we spoke about this in previous episodes, but when you get to the age of 50, 80% of people, like of everyone, will have some form of disc degeneration, right?
Yeah.
And that's normal. Like, that are completely normal age-related changes. We've convinced ourselves that anything that looks slightly imperfect on a spinal x-ray is just, or an MRI, is just like completely huge problem. But it's not. They're just completely normal age-related changes. That's not to say like things like cauda equina, where you've got discs pushing on your nerves, like that. That is problematic. That's a serious condition.
Yeah, absolutely.
But really, like, there's so many times when clinicians just don't really know what to do to help you. They're like, fuck it, send them for an x-ray. Okay, the x-ray showed nothing. Fuck it, send them for an MRI. Oh, fuck it, yeah, we'll send them for an ultrasound. Like, all these different things. And it's just, it costs the NHS so much money.
And it's not just that. Like, X-rays and MRI, they're very quite low risk sort of imaging. But if you're doing CTs, I'm just taking this off the top of my head from something I read a few years ago. But of children, so this is a study in children and adolescents. Of those people that have a CT scan in childhood, the rates of cancer, of any type of cancer, is just so significantly increased. I think it's more than a 20% increase.
Yeah, we'll have to get the exact number in the references.
We will put the exact number. I've got the paper somewhere.
But yeah, it's really, really elevated, isn't it?
Yeah, so like when you're thinking about these scans, they do impose a risk. Now, if you're in your 60s, then that risk is significantly ameliorated because, well, you've already got to the age of 60 and the chances of developing cancers thereafter, well, most clinicians that I've discussed with and radiologists, the risk's a lot less. And particularly if you're getting a scan at that age, it's for, do we need to do surgery? So it's an essential scan effectively.
Yeah. You're not scanning for the sake of it.
Yeah, we try not to scan for the sake of it. That's evidence-based medicine, but it does happen.
There was a study in the States where they looked at the people being sent for lumbar spine x-rays.
Okay, yeah.
And they found that in this particular study, there was 68,000 lumbar spine scans that were wrongly prescribed. So there were no red flag symptoms. There were no symptoms that, according to guidelines, should have resulted in these scans, right? And across this study, they found that 1 in 2,500 of those scans had a serious pathology, right? But that's a huge expenditure to find basically what you found by luck. Like, if they're not actually showing the symptoms of a serious pathology, like a cancer in the spine, for example, okay, you could say, well, we should do as many x-rays as it takes. But then you could argue, just x-ray everyone all the time. And then you're going to elevate the risk of cancer anyway.
Well, yeah, I mean, what we need to look is as clinicians, we look at the number needed to treat. So how many interventions do we need to do to get a positive outcome? And by positive outcome, I mean like a positive diagnosis of something.
Yeah.
Compared to the number needed to harm, which is for example, causing a cancer, for having a negative effect to sort of like contrast or something like that.
Yeah.
Those types of things.
That's quite a morbid ratio.
But it's not,
no,
the doctor's
it's
not
important.
trying to cause the harm. It's just like
No,
how
no,
many
no.
times given a treatment would that cause harm to someone? Like
Yeah, so it's-
how many would it take to cause harm?
It's how we assess it.
Yeah.
It's how we can objectively say, okay, we're giving lots of X-rays. X-rays are very low. Well, they have some radiation, but they're very low risk in terms of actually anything. So we can X-ray everybody. Well, we shouldn't, and we don't. But having an X-ray of somebody is not going to be really a worrisome thing.
Yeah. Can I ask a quick question? You'll probably have heard this stat, Josh, so this question doesn't go to you, this is to Don specifically.
Okay.
I want you to tell me which one is a higher dose of radiation, right? A transatlantic flight from London to New York, an X-ray, like a full chest X-ray, or a handful of Brazil nuts.
Oh. Well, Brazil nuts is interesting, but I don't think it could. Wait, would it? What? Or have you just thrown that in there to confuse me? I'm going to go, since we were just talking about X-rays, I'm going to go with the X-ray.
No, it's a handful of Brazil nuts.
Oh, I knew it.
They give off so much radiation that if you hold a handful of Brazil nuts for the same time it takes to get an X-ray, you get a higher dose of radiation.
Is that why they're so expensive?
No.
What?
Because you're just subjected to radiation.
Wow.
It's like buying radium.
Yeah.
Yeah, so there you go. Sorry, that was a big old tangent. Thinking about money saving though, in terms of scans, there was an education program in the Australian Health Service where they basically went back to doctors and were like, "We're going to teach you how to actually refer cases of lumbosacral pain, like for X-ray when it's relevant." And in 1 year, they managed to reduce their scans by nearly 11%, and they saved nearly 12 million Australian dollars. So what's that, like 7-ish million
That's
here,
about half,
pounds?
isn't it?
Yeah.
So yeah, like I know it's not going to completely change the NHS if we do this, but like a few million helps, right? That can make a big difference to some people's lives that really need that money. So, yeah, and it's not just unnecessary scans that happen; it's unnecessary surgeries as well. Like there was a cool study in, I say cool, but quite morbid, but it's cool nonetheless. In Norway, they looked at people who underwent spinal fusion for back pain. So like the fusing of your vertebra, like fusing the discs, sometimes inserting concrete into the discs. Yeah.
Wait, concrete?
To fuse the bones, you basically put in concrete. I think it might actually be concrete.
No.
We'll search that up. But either way, like fusing the discs in the spine.
How does the body not react to that?
I mean, you've not got much immune activity in your spinal cord. Point being, 53% of the people that underwent a spinal fusion were still on disability benefits 4 years later, right? So they're still obviously having a high impact on their life, compared to just 32% of people who had their pain managed in any other way. So there were some people who it was medication, some people it was physiotherapy, some people it was more holistic approaches, but only 32% of those people were still in that position needing to claim disability benefits, but 53% of the people who had surgery.
Yeah, I'd
Still
love to
needed
see
it.
how the cost of that
Astronomical.
weighs out, yeah.
Yeah, astronomical.
Now, Josh has been very good to allow us to criticize clinicians, just absolutely ripping into them so much, and their lack of education. There is something that every listener needs to take from this episode. Clinicians are expected to know an enormous amount of information about a really broad range of topics, and they're being taught in universities that might not necessarily prioritize pain in the way that we'd like to, and it's not a clinician's fault if they come out of education with poor knowledge about pain, just because things should have changed in the education system a long time ago does not mean that the blame is on the clinicians.
Yeah, I mean, I'll be the first to admit the doctors, we're not gods, we're not omniscient, we're not omnipotent. We can't physically know everything. I mean, that's an impossibility. And the majority of us are trying extremely hard to know as much as possible. But, sometimes we just have to pick our battles.
Yeah.
I know, for example, I've got exams coming up to go for specialty training. And do I have 30, 40, 50 hours to learn about chronic pain and the ins and outs of it, compared to what do I need to know to be able to get onto my training regime? It's it's a tightrope that we need to really tread quite finely.
Yeah.
But I mean, there are some positive changes on the horizon. The first of these being that there are now more courses for clinicians to go on to give them the knowledge about chronic pain. That's once they've qualified, so not necessarily as a student. This contributes towards their continued professional development, and something important which all doctors, regardless of what level you are, we try to continually improve. It's how medicine's evolved over the millennia.
Yeah.
And for any clinicians listening, I've listed lots of these courses that you can attend, and these are in the show notes. We'll make them all available. So, I mean, even if you're not a clinician, you can just have a little peruse there. You might find something interesting.
Yeah, absolutely. And there are the beginnings of some changes happening at the undergrad level as well. So there were 2 doctors over in Australia, and I apologise if they ever listen to this and I butcher the pronunciation of Roger's name. It's Dr. Roger Gouk? Gouk?
I'd say Gouk.
Goucke.
Let us know.
Gouk. And Dr. Wayne Morris. And they created something called the Essential Pain Management Module. It's a module for both undergraduates and postgrads to learn more about pain. It covers what pain is, why it needs treating, assessment of severity, different classifications, so like neuropathic, nociplastic, acute pain. It looks at pain physiology and pathology, it looks at different treatment methods, it looks at medications and different case discussions, and it's really, really powerful, and it's been spreading worldwide, and there's been people in different countries taking it up. And here in the UK, a fantastic pain nurse, actually the head of the Pain Nurse Network at the time of recording, Martin Galligan, who I've had the privilege of speaking with at some conferences. He's a very nice guy. He's helping to grow the profile of this course in the UK alongside a pain specialist nurse who has my favourite name ever, which is Sharon Kitcat.
Yeah.
Oh.
And I was just like, I read it and I was like, that must have been hard work, Sharon. Why not have a break?
She wouldn't have been allowed to have a break.
Oh, that's great.
Oh, so there you
As
go.
a man from York, I really appreciate the Nestle jokes.
Yeah.
Also, it doesn't really take much extra education to start improving the situation. There was a study back in 2017 that found that a 70-minute lecture could significantly improve clinical knowledge of pain management. Now, obviously, that will make them experts, but it shows that even small changes can have a big impact, and it just introduces people to the topic. And if they're interested, they usually go more into it.
Yeah, and I mean, like I said earlier on, there's still a long way to go. Like when I wrote to a certain university and they told me that their pain management curriculum was great, like if I'd been able to go in there and do that 70-minute lecture, I'm not acting like I'm gonna fucking change the lives of these students, but who knows, maybe it could have made a difference. So something as small as that really can start to kind of push the needle a little bit. So yeah.
Nice, yeah. Any other comments, Don, Joe? Okay, excellent. In that case, I'm going to check up on how Don is doing.
So I've decided to read this book called Anatomy by James McDermott, and it's a book given by my lovely housemate Paul. I believe it was a book that was written by one of his friends, so I'm really honoured and grateful to read it. Thank you, Paul. So for a bit of context, Anatomy is a book consisting of a bunch of poems to describe the life of a gay man living in rural England, specifically East Anglia. And it goes through the different stages of life. So you've got youth, adolescence, adulthood, and what it's like to come to terms with his sexuality and how it affects relationships with partners, family, and friends. And each of those periods takes up about a third of the book. So one thing that I found quite interesting about the book was the structure of the poems. They all kind of vary, but he does use a lot of repetition, but not in the boring and monotonous style that I used to see back in my GCSE days, but it's a more creative way to emphasize the point or theme of the poem. And I think that's something that I'd like to adopt into my own poem. One more thing that really stood out, I've not really explored much of the book yet, but one more thing that stood out was the kinds of themes that he explored. So they were all very personal, very relevant to, I guess, modern life, and very relatable, which is what I think most people are attracted to when they read this book. So that's, again, one more thing that I can put in my own poem, hopefully. I still have no idea what it's going to be about, but we'll find out, so stay tuned.
I don't know about you listeners, but I am very excited to see what Don has up his sleeve for the rest of his 20-hour challenge, and we will share it with you all throughout the next few episodes.
So with that, we've only got 2 things left for you this week. First, our Egyptian laxative of the week this week is...
Licorice!
Licorice, the disgusting, horrible thing.
So if you're there with a pack of licorice all sorts and you feel like me and you're like, God, I really hate licorice, well, why not try inserting it into your rectum?
Oh, is it another insertion one? Like, why can't
people just eat them normally? And secondly, our book review this week in the store is The Story of Pain by Joanna Burke.
Yes, so Joanna Burke wrote a really nice book called The Story of Pain, and it takes you on a little bit of a journey through some history of chronic pain. It takes you through some of the sort of basic science of it. It talks to you about pain education. It talks to you about modern pain theories like the gate control theory. It's a really nice book. I gave it a 7 out of 10.
Ooh,
quite good.
7's really good.
Relatively good. There's better pain books out
Damn.
there, but again,
Well done, Joanna.
compared to a lot of the pain books out there, it's much easier to buy, which helps. You can actually find it on, I think you can still find it on Amazon. You can find it on World of Books, Aid Books. Other bookstores are available. But yeah, overall, very good book. Would recommend.
Nice,
Go buy a copy.
yeah.
Can you tell us a bit more about Joanna?
I know very little about Joanna.
Okay, well, there you go.
I'm going to Google right now and tell
If
you.
you want to
more.
find out more about Joanna,
So
she's
Jo-
got blonde hair.
She does have Joanna. She does
Does
have
have Joanna.
So Joanna Burke is a professor of history. Oh, I never realised that. She's a professor of history at Birkbeck College at the
I think it's
University.
Birkbeck.
Birkbeck.
There's an extra K in there.
Is there?
Yeah.
You're joking.
I think there is. Birkbeck.
Oh, Birkbeck. Wow, okay. Interestingly, she researches sexual violence, animal and human-animal relations, violence, war, emotions, psychiatry, medicine, and the body. So she's
That was a roller coaster.
killing it. She's written other books. She's written An Intimate History of Killing. She's written Rape, A History from the 1860s to the Present, and What It Means to Be Human, Reflections from 1791 to the Present. So really, she is covering some ground
A
here.
lot of ground. So, with that, we wrap up our pain education episode. If you want to learn more, you can see all of our references in the show notes below. And if you like what we do here at Pain in the Podcast, and you can spare £1 or 10 or more,
10? Well, okay.
whatever you desire, each month, then we will be forever grateful.
Yes, and you can keep on paying for our decaying houseplants that we have on the table.
And my probably very dirty socks.
And our doors that don't close properly.
Yeah, you can help us plane the doors. Anyone watching on Patreon, you
Yeah.
can see that we need to plane this door.
We're currently sat on my bed.
If you're feeling flush and you do want to donate to us on Patreon, you can hear our outtakes, watch behind the scenes footage, everything that we do in an episode. And trust me, there's a lot that does not make
It's
the
just
podcast.
me talking about some very inappropriate things.
Yeah, that's getting cut even from the Patreon. So we've got a lot of bonus content coming along the way, and if you want to see the 20-hour challenges and some more updates, you're going to see it all on there. So, whether you choose to donate £1, £5, £10 a month, or even if you just want to listen along for free, that's all fine. We don't really mind. We just want you to enjoy our podcast, really, don't we?
Yeah.
Yeah.
And tell your friends, tell your family.
Yeah.
Yeah.
Tell anyone. Tell people in the hospital waiting room. If you've got chronic pain, you're at a pain clinic, tell everyone.
Yeah. Make chain emails if you want. We'll take any viewers you can get.
What are they called? The text that people used to send, like
Chain
weird
messages.
Chain messages,
Yeah.
but they used to send like weird horror stories
Yeah,
by text,
like,
and everyone
if
would.
you didn't do this, your mum would appear as a ghost behind your bed or something.
Yeah. Send some creepy pastas with a link to the podcast.
Yeah.
But no, at the end of the day, this podcast is there just to educate people, so do share.
Yeah.
And even if you don't sign up on Patreon, we're just glad to have you listening. So until next time, thank you for listening, and see you next week.
Goodbye.
Goodbye.